Bismillahirrahmanirrahim. Quote of the day: Have mercy on those on earth, and the one on in the heaven will have mercy on you. Hazrat Muhammad, peace be upon him. Introduction. Today, the topic of presentation is Introduction to the Occupational Health. I am Dr. Rabbia Iqbal, PGR Community Medicine, and I am presenting under the supervision of Professor Dr. Saira Afzal, who is the Dean of Institute of Public Health, Lahore. Learning objectives of today's presentation are historical background, introduction to the occupational health services, occupational medicine, health of the workers, sickness abstinence, prevention and control of the disease, international regulation and conclusion, and MCQs at the end. Learning outcomes. By the end of this presentation, participant will be able to understand about the occupational health and its prevention. Definition. Occupational health is defined as the effect of the work and the working environment on the health of the worker and the influence of the state of the health of the worker on his ability to perform work for which he employed. Historical background. Ancient origin of occupational health. Um, Ancient Egypt, mining seen as a hazardous, only criminal and slave employed in the mines. Hippocrates first described lead toxicity in miner, advised asking what is your occupation. Agricola and Paracelsus first systematic observation on miners' disease. Paracelsus wrote monogram on mine and smelter worker. Modern era industrial revolution brought occupational diseases to the public attention, combined effort of reformers, improve worker condition. In 20th century, rapid progression after World War, developed countries paid high price in worker and morbidity and mortality. Next is the introduction to the occupational health. Uh, it is defined by combined by ILO and WHO Joint Committee in 1950 promotion, maintenance of the highest degree of physical, mental, and social well-being of the workers in all occupations. Prevention of departure from the health caused by the worker condition, protection of workers from risk resulting from the factor adverse to the health, adaptation of work to man and each man to his job. So the core concept of this is it is two-way relationship between health and the work. Preventive medicine and occupational health have the same aim, the prevention of the disease and the maintenance of the highest degree of the physical, mental, and social well-being of the worker in all occupations. Level application include health promotion, specific protection, early diagnosis and treatment, disability limitation, and rehabilitation. Primary focus and response. Primary responsibility for the health and safety rests with management. A main function is to promote and maintain health of the whole enterprise, provide expert advice to the management on the standard of health and safety, health education to the worker regarding personal safety. Advice is given at the two levels. First, top management level, which formulate health and safety policy, and second is the line manager and supervisor for the day-to-day problem of health and the environment. Next is the function of occupational health services. Uh, Placing people in a suitable work, pre-employment exam, emphasize on placement and replacement, not rejection, match capability to the job. Second is the maintaining worker in a suitable work, routine screening after illness or injury, identify those needing job modification or workload reduction. Third is providing treatment, efficient treatment of the injury, acute illness, gassing, and poisoning, reduce sickness and boost morale. Fourth is controlling recognized hazard for most function, combined medical surveillance and environmental monitoring can eliminate occupational diseases. Next is identifying unrecognizable hazard research, clinical observation, epidemiological study, and toxicology to identify new risk, avoid potential risk, consultation at design planning stage to prevent injury in a new or modify plant processes. Screening for non-occupational diseases, for example, malaria, mental illness, hypertension, heart diseases, early detection via regular screening. Next is the health education and safety training, formal training program, educate management and employee on the health and the safety practices. Sanitary catering and welfare to advise on sanitary regulation, high standard, especially critical in developing countries, kitchen and canteen need particular attention, educate welfare amenities for all workers. Environmental control outside place, prevent industries adversely affecting neighbor communities, control discharge of toxic effluent and waste, control public noisiness, for example, noise, smell, and dust, coordinate with local environment health authorities. Next is occupational medicine. In developed countries, specialty within the preventive medicine with some therapeutic function, separate status within the community medicine is maintained. In developing country, for example, in Pakistan, it's not possible to maintain separate specialty status. Most coordinate occupational health activity with prevailing community health program. So, doctor responsibility in industry is are work environment knowledge, medical examination, treatment, health education, and prevalence studies. Medical examination, pre-employment examination, and periodic medical examination. Pre-employment examination include assess fitness to perform a specific job, detect remediable ill health that may affect ability to work, establish baseline health status. Priority groups include driver, food handlers, chemical worker, radiation workers. Periodic medical examination, specific reason, specific objective, specific consequent action. Most important, post sickness absence exam. Match job with employee after recent illness. Priority include HTGV drivers, young workers, food handlers, chemical workers, biological monitoring for chemical overexposure. Next is medical record, minimum record at any place of the environment, accident and dangerous occurrence book, daily clinic attendance record, name, age, department, reason for visit. Individual record include personal detail, examination and treatment given, clinical attendance summarized by week, month and year, by disease or injury. Purpose, basic epidemiological assessment plan, improve service safety and health education program. Next is health of the worker. Occupational hygiene, it is defined as identification, measure, appraisal, and control of the risk for physical, chemical, and biological workplace factors. Key duties of an occupational hygienist include recognize and evaluate health hazards, study work processes, include material emission point, duration, protection, equipment use, implement measure to control, identify hazard. Threshold limit value produced by ACGHI adopted worldwide. It is not absolute. Threshold limit value may not protect all workers. Next is toxicology. It is defined as a study of noxious effect of the chemical substance and physical agent and their potential for adverse effect on the body. First principle, all substance can kill if given in the inappropriate quantity by an inappropriate route. Hazard is determined by absolute toxicity, concentration, duration, and route of exposure. Route of entry into the body, inhalation, ingestion, and skin absorption. Next is occupational hazards. It includes safety hazard, biological hazard, physical hazard, ergonomic hazard, and chemical hazard. Physical hazard include radiation, noise, vibration, extreme temperature, pressure. Chemical hazard include dust, fume, solvent, pesticide, heavy metal, organic compound. Biological hazard include viruses, for example, hepatitis B, C, um, tuberculosis, anthrax, fungal infection, and parasitical infection. Psychosocial include monotony, overload, shift work, poor leadership, job insecurity. Ergonomic include repetitive motion, poor posture, manual handling, poor workstation design. And number one is a physical hazard. Physical hazard are the one of the most common workplace risks stemming from environmental factors that can harm an employee without direct contact. It includes noise. Continuous exposure to the loud environment can lead to hearing loss, vibration. Regular use of the vibratory machine can cause conditions such as hand-arm vibration syndrome. Extreme temperature, working in excessively hot or cold environment can lead to heat stress or hypothermia. Radiation exposure to the ultraviolet, infrared radiation, or microwave radiation can cause burn or long-term health effects. Chemical hazard are present when worker is exposed to any chemical compound that could harm their health. These can exist as a solid, liquid, gas, mist, or fume, and the danger varies widely between substances. It includes liquids such as paint, solvent, cleaning products, gases like carbon monoxide, chlorine, and ammonia, fume from the welding or any exhaust, dust of wood, cement, or asbestos. Biological hazards come from the working with the people, animal or infectious plant material, job in healthcare, laboratory, outdoor, and other similar environment can expose workers to these hazards. Blood or other bodily fluid can transmit diseases. Fungus, mold exposure can cause respiratory issue. Bacteria and virus can lead to various infection. Insect bite can transmit disease or cause allergic reaction. Psychosocial hazards. Psychosocial hazards affect employees' psychosocial health, potentially leading to stress, burnout, or more serious mental health issues. These hazards stem from the design and management of work and social context of the work. Workplace violence from the colleague or client, harassment and bullying, creating a hostile work environment, excessive workload leading to stress and burnout, lack of control over work process and outcome. Next is the safety hazard. Safety hazard are the unsafe working condition that can lead to injury or illness. They are perhaps the most straightforward in terms of identification and mitigation. Slippery floor can cause fall. Unguarded machinery poses a risk of entangle or imputation. Electric hazard from exposed wiring or bad condition. Working from the height without proper fall protection. Environmental hazard arise from the workplace or the work environment impact or other wider environment. These hazards can affect health through exposure to the air, water, soil pollution, and other environmental factors. Air quality issue due to pollutant, dust, and mold. Water pollution affecting clean drinking water sources. Asbestos exposure in the older building and cause respiratory issue. Hazardous waste handling and disposal pose risk of exposure and contamination. Next is ergonomic hazard. It is defined as a scientific discipline studying interaction between human and the element of the system. It is a Greek word. Argos mean work plus nomos mean law, fitting in the job to the worker. Ergonomic tripod include man, machine, and environment must suit each other from the maximum product without harm. Type include physical, cognitive, and environmental. Physical posture, manual handling, repetitive movement, workstation design, cognitive, mental workload, stress, decision making. Environmental include climate, temperature, vibration, and lightning. This is a picture showing the average occupational injuries, accident, disease per annum in Pakistan, in which due to fires and explosions and exposure to the harmful substance or the environment, this is due to the fall, assault, and the violation, contact with the object and the equipment, transportation in incidents. Occupational diseases. Disorders include acute inflammation, irritant gases, SO2, phosphogen, ozone, formaldehyde, bronchitis, cause bronchitis, pulmonary edema, chemical pneumonia. Pneumoconiosis include silicosis, asbestosis, soil worker pneumoconiosis. Occupational asthma due to organic dust, isocyanate, grain dust. It is a reversible airflow obstruction. Next is the extrinsic allergic alveolitis, farmer lung, bird fascinar lungs, and type 3 hypersensitivity. Occupational cancer include 300 to 350 carcinogen, benzene, chromium, asbestos, arsenic, nitrosamine. Occupational cancer is the most serious problem in the industry. Most common industrial cancers include skin cancer, lung, bladder, blood-forming organs. Control of the industrial cancer elimination or control of the industrial carcinogenic technical measure like exclusion of the carcinogen from the industry, well-designed machinery, closed system of the production, etc. Medical examination, inspection of the factories, notification, licensing of the establishment, personal hygiene measure, education of the worker and the management, and research. Next is the sickness absenteeism. It is defined as the absence from the work attribute or to the sickness or the injury, key indicator of the worker health and effectiveness of occupational health services. It is causes of include occupational, non-occupational, and psychosocial. Occupational causes include injury, chemical poisoning, respiratory diseases, hair loss. Non-occupational include infectious, cardiovascular, psychiatric diseases. Psychosocial include monotony, poor job satisfaction, poor management relation. Measurement can be done by frequency rate and the duration rate. Frequency rate by spell over worker and duration rate day loss over worker. Management of sickness absence include post-sickness absence exam and in which include most important periodic examination, match job to employ in the light of recent illness, cardiac, neurological, infectious diseases review before return, recommend job modification, reduce workload or transfer, document all findings for medical and the legal record. It can be managed by level of prevention, primary, eliminate hazard, ergonomic improvement and vaccination, secondary, periodic screening, biological monitoring and spirometry, tertiary, rehabilitation, return to work program, the job redeployment, management role, modify duties, phased return and absence policies. The global burden of the occupational health diseases, 2.6 billion global labor force, 75% the developing countries, 40 million new workers added per year, mostly in the developing countries, 250 million occupational injuries per year, 3 lakh and 30,000 and annual fatalities from the work-related injuries. Next is the prevention and the control of occupational diseases. Um, by elimination or substitution, replace hazardous substance or the process with a safer alternative. For example, replace benzene with the toluene. Engineering control, lake exhaust ventilation, and enclosed processes, machine guarding, noise barrier, automated operation. Next is third is the administrative control, job rotation, reduce exposure time, safe work procedure, training, shift scheduling, personal protective equipment, respirators, glove protector, clothing, hearing protection, last line of the defense only. Next is international regulation, ILO and WHO framework. Um, ILO WHO Joint Committee 1950 defined foundational aim of the occupational health for the first time internationally. Key ILO convictions include C155 Occupational Safety and Health Conviction, 1981 C161 Occupational Health Service Conviction, 1985 C187 Promotional Framework for Occupational Safety and Health, 2006. WHO Global Plan of Action on the Workers' Health 2008 to 2017, protect and promote health at the worker, prevent disease, strengthen occupational health services. WHO Plan of Action on Workers' Health 2008 to 2017. Um, Key objective of this plan include devise and implement policy instrument on worker health, protection and promote health at the workplace, covering all the worker include informal and small scale industries. Health services include improvement performance and access to the occupational health services, linking them to the primary health care, provide and communicate evidence for action and practice, improving the knowledge base, mainstreaming, include incorporate workers' health into the other policies such as environmental protection, trade, and development. Uh, Core focus areas and implementation, target population aim to bridge gap between countries and between formal informal workers, targeting occupational risk, addressing respiratory diseases, musculoskeletal disorder, and psychosocial factors. Partnership encourage collaboration with international labor organization and other stakeholders. Next is the Pakistan Occupational Health and Safety Act 2018, an act to ensure safe and healthy working conditions for the people at the work by authorizing enforcement of the rule and the regulation developed under the act, by assisting and encouraging the organization, institution, and geographic areas governed by the federal government in their effort to ensure healthy, safe working conditions by providing for research, information, education, and training in the field of the occupational health and the safety. Uh, Factories Act 1934, Basic Safety and Health Provision, West Pakistan's Shop Establishment Ordinance, Work Compensation Act, EOBI, Employee Old Age Benefit Institution. Challenges in developing world include majority of the workforce in the agriculture and informal sector, limited access to the occupational health services, low awareness among workers and employees, inadequate enforcement or existing law, economic priorities override worker safety concerns. So the conclusion of this is occupational risks are present in every profession with the Even technology, no matter how beneficial it is, can exert a negative impact on some member of the population. The reality is to balance maximum benefit and a minimum harm to the population and well-being. Once identified and recognized as risk, new guidelines, precaution, and protocol should be rapidly instituted to reduce or even eliminate the hazard. Application of ergonomics and administrative measures contribute greatly in reducing the occupational hazard in professional groups. Next is the recent updates. Occupational health and the safety performance in the high-rise building project in Pakistan, a systematic literature review. The building industry contributed an impressive share in Pakistan growth sector, where the construction industry contribute 2.74 of the GDP of the Pakistan. This review focus on adopting equality approaches using the comprehensive literature approach for taking the current practice in health and safety and OHS laws in Pakistan building industry. Finally, it is propose a realistic strategy for the developing a safe environment at the workplace. It indicates that Pakistan construction sector should consider worker safety as a priority, update and enforce safety laws at the workplace to enrich OHS condition in Pakistan's construction sector. Next is ergonomic and occupational health in sugar industry of Pakistan. This study was conducted in the sugar industry of Pakistan to analyze the ergonomic and occupational health status. The results show that 15 to 20% workers were injured during the season in the sugar industry of the Pakistan. It also observed that 40% of the total working staff was equipped with the safety equipment. On average, 80 to 112 decibel noise level were recorded in the sugar industry that affect the human health very badly. It was found that 50% of the work were not equipped with the safety measures. This result also show that the working condition exists in the sugar mill were not satisfactory regarding the ergonomic and occupational health. The study suggests that there is need to recruit the skilled manpower to minimize the injuries in sugar industries of Pakistan. Next is the MCQ. A factory introduce a new chemical solvent and replace the benzene with a safer alternative to reduce work exposure. Which level of prevention is primarily applied? A. Administrative control through the worker rotation. A. To reduce chemical exposure. B. Elimination or substitution of the hazardous substance in workplace process. C. Personal protection equipment such as respirators or gloves. D. Periodic medical examination for early detection of chemical diseases. C. Rehabilitation program for workers affected by the chemical exposure. B is the right option. MCQ number 2. A worker complained of disc pain due to repetitive typing and poor workstation posture. Which occupational hazard categorized best explain this condition? A. Chemical hazard due to chronic exposure to the toxic workplace solvent. B. Biological hazard due to the exposure to the infectious agent in office. C. Ergonomic hazard due to mismatch between worker and workstation design. D. Physical hazard due to exposure to the noise and vibration. E. Psychosocial hazard due to workplace stress and job
C.
Yes, C is the right option. MCQ number 3. A healthcare worker developed hepatitis B after a needle stick. This is an example of which type of occupational hazard. A. Of mechanical hazard result from the injury by sharp medical instrument. B. Chemical hazard due to exposure to disinfectant and cleaning agent. C. Biological hazard due to exposure to the infectious body fluid. D. Physical hazard due to exposure to the radiation in the hospital setting. E. Psychosocial hazard due to the stress and long working hours.
C.
Yes, C is the right option. MCQ number 4. During the workplace inspection, an officer recommends installation of local exhaust ventilation to reduce dust exposure. Which type of control measure is this? A. Engineering control aimed to at reduce hazard at the source. B. Administrative control through the modification of work schedule. C. Personal protective equipment to prevent inhalation of dust. D. Medical surveillance to detect early occupational diseases. E. Legislative control through enforcement of safety regulation.
A.
Yes, A is the right option. MCQ number 5. A company arranges periodic health screening and spirometry for work exposed to dust. Which level of prevention does this represent? A. Primary prevention through elimination of workplace hazard. B. Secondary prevention through early detection of disease. C. Tertiary prevention through rehabilitation of affected workers. D. primordial prevention through policy and health promotion, E, administrative control through limited exposure duration.
B. B.
Yes, B is the right option. MCQ number 6, a factory report increased absenteeism due to stress, monotony, and poor management relation, which is the most likely contributing factor. A, physical hazard due to excessive workload, noise, and vibration. B, chemical hazard due to toxic gases exposure in the workplace. C, biological hazard due to spread of infectious disease. D, psychosocial hazard due to poor job satisfaction and stress. E, mechanical hazard due to unsafe machinery and injury.
Psychosocial hazard.
Yes, D is the right option. Psychosocial hazard due to poor job satisfaction and stress. MCQ number 7, a factory introduce job rotation to reduce prolonged exposure of the work to the hazardous task. This is an example of A, engineering control through modification of equipment design. B, administrative control through change in work organization. C, personal protective equipment to reduce exposure risk. D, elimination of hazard by removing dangerous process. E, medical prevention through regular health checkup.
Administrative.
Yes, B is the right option. MCQs number 8. A policy integrate occupational health services with primary health care to improve access to the formal worker. This reflects which international approach. A, OSHA regulatory enforced within the industrial workplace. B, ILO convention on occupational safety and health standards. C, WHO global plan focus on integration with primary care. D, factory inspection system under national labor law. E, employee based occupational health services delivery model.
C.
Yes, C is the right option. MCQ number 9. A worker is a coarse storage present with the numbness and tissue damage due to prolonged exposure to the low temperature. This is classified as A, chemical hazard due to exposure to the refrigerator gases. B, physical hazard due to the extreme environmental temperature. C, biological hazard due to the microbial contamination. D, ergonomic hazard due to rapid manual handling. E, psychosocial hazard due to stressful working condition.
B.
Yes, B is the right option. MCQ number 10. A factory worker exposed to the continuous loud machinery develop gradual hearing loss, which prevent strategy would have been most effectively initial. A, periodic audiometry screening to detect early hearing impairment. B, use of hearing protection devices such as earplug and ear muff. C, installation of noise control measure at source of machinery. D, rehabilitation and compensation for occupational hearing loss. E, transfer of the worker to less noisy department after symptoms.
C.
Yes, C is the right option. The answer key. This is the YouTube channel where the presentation will be uploaded. Thank you.
Thank you very much, Dr. Rabbia. This is a very good presentation. The most important part is that the ergonomics and the occupational hazards both have been covered in a befitting manner. Thank you very much, everyone, for your listening, and I am hopeful that today's presentation would have been a source of more knowledge as well as your professional growth. Thank you very much.
Thank you, ma'am.
Thank you, ma'am.